Heart attack. This happens to your heart 1 week before you get a heart attack. A heart attack happens when a part of the normal heart muscle doesn't get enough blood. This makes the heart to stop beating and then you die. Normal heart rate while resting for adults ranges from 60 to 100 beats per minute. Generally, a lower heart rate at rest implies more efficient heart function and better cardiovascular fitness. For example, a well-trained athlete might have a normal resting heart rate closer to 40 beats per minute. To my dear friends with obesity, people with high blood pressure, those with diabetes, and for those taking alcohol heavily, you are at a risk of getting a heart attack. So, if you get the following signs, just know in the coming week, if not hours, you are about to get a heart attack. 1. Sudden chest pain, especially on the left side of the chest radiating to the left arm and left shoulder. If you get this pain, you feel like a sharp punch in the chest. 2. You wake up in the morning feeling very tired. 3. You get shortness of breath. 4. Swollen feet. Better see a doctor, because see what is happening to your heart. When the blood vessel taking blood to the heart gets blocked by either a blood clot or excess fats in the blood vessel, the muscles start drying up and the heart is unable to contract or to beat normally. When the heart is not pumping well, the body organs like the kidneys don't receive enough blood, and then the kidneys stop working. This is very, very dangerous because when the kidneys stop working, all the chemicals in blood are not removed, thus accumulate and cause severe damage to other organs. If no interventions are urgently made, then the brain dies and finally a person is declared dead. In next video, we shall practically how to prevent heart attack while at home. Please click on the bell icon to get a notification when the video is premiering.